10 early warning signs of cervical cancer you must know. According to the American Cancer Society, almost 4,300 women die of cervical cancer each year in the United States alone. This is a shamefully high number since this type of cancer is typically preventable and treatable if diagnosed early. However, many women often do ignore some early warning signs they might experience. If you have a family history of cervical cancer, or you're worried that it might be something you'll develop, see a doctor and get tested as soon as you experience these early symptoms. 1. Abnormal discharge. Some vaginal discharge is perfectly normal. In most cases, it will be a relatively benign condition like vaginitis or bacterial vaginosis. However, it could also be an early warning sign of cervical cancer, especially if the discharge is foul-smelling and slightly brown. But once you experience changes in color, consistency, and odor, you should book an appointment with your gynecologist right away. 2. Vaginal bleeding. Bleeding when you're in between periods is another early symptom of cervical cancer. Most often, it feels exactly like your normal menstrual flow, except it occurs outside the schedule of your normal flow. It may not be a heavy flow and might not even cause you any discomfort. 3. Heavy periods. Apart from bleeding between your periods, early cervical cancer can cause your periods to become heavier than usual. Additionally, this could happen even after menopause. You might bleed more heavily, or your bleeding could last for several days longer. You might also notice more discomfort or even pain. 4. Pain during intercourse. Early cervical cancer can make sex painful for you because your cervix is inflamed. If left untreated, this could lead to the growth of tumors not only on your cervix, but the rest of your reproductive organs. If you notice any discomfort in your cervix, especially during sex, you should get screened as soon as possible. 5. Unusual vaginal sensations. At the early signs of cervical cancer, you'll notice some unusual feelings in your vaginal area. Symptoms are different between individuals, but the most common reported experiences include itching or a painful burning sensation. When examined, the gynecologist will often see changes in the color of the vulva. 6. Pelvic pain. Pelvic pain is one of the most recognizable symptoms of cervical cancer. Although this is a common symptom among women, it usually manifests as a dull but continuous ache for cervical cancer patients. If the pain radiates out towards the appendix, likely cancer has already progressed. 7. Lower back pain. Sometimes issues with the reproductive organs can manifest as lower back pain. Similar to pelvic pain, this lower back pain caused by cancer of the cervix is persistent. It can feel like a dull ache, or it could be severe. In some women, it is more painful on one side than the other. 8. Frequent urination. Apart from reproductive organs, the pelvis contains your bladder. If there's inflammation in your cervix and the rest of your reproductive system, it could press onto your bladder and give you the urge to urinate more frequently. You'll also feel like it's more painful when you try to hold your pee in. 9. Bloating. Although bloating is more often a sign of ovarian cancer, it also occurs for women with cervical cancer. This might be accompanied by indigestion, undue pressure on your uterus, or even cramps. Some women also experience other issues like nausea, flatulence, or vomiting. 10. Inexplicable fatigue. Your body is working hard to fight diseases, and that's where most of your energy goes. Although it's normal to feel overly tired, especially when you're constantly busy and stressed, feeling fatigued for no apparent reason might be caused by an underlying illness. If you're unsure why you might be feeling this way, contact your doctor, and they'll let you know if it's time to see your gynecologist. Whether or not cervical cancer runs in your family, you should talk to your doctor about the possibility of getting an HPV vaccine. According to the World Health Organization, 99% of all cervical cancer cases are caused by human papillomaviruses, HPV. which are now preventable thanks to advances in modern medicine. Most importantly, you should go for regular gynecological screenings, especially if you are 35 years old or over. At a minimum, you shouldn't go beyond 5 years without getting PAP and HPV tests, following our study references we used to create this video. I hope you liked the video. Please do not forget to like, subscribe, and hit the notification bell. Thank you.